Welcome, everyone, to Vagina Talk podcast. We are Dr. Alexis May Kimble, and I am Dr. David Kimble.
We're two double-boarded female pelvic reconstructive and cosmetic surgeons.
This is the podcast where we have honest conversations and discuss important and often misunderstood topics. Our goal isn't just to answer taboo questions or probe into taboo-related issues, but it's really to promote healthy discussions. Hopefully that'll lead to healthier lifestyles. Hey everyone, welcome back to Vagina Talk by Drs. Kimble and Kimble. I'm Dr. David Kimble. This is my lovely wife, Dr. Alexis May Kimble. And as you probably have heard, Vagina Talk is a relatively new podcast that we've been doing, for a few months now, I would say. We're trying to unleash some of the taboo topics that surround the vagina, make sure that, it's not a naughty word or a bad word to say at home. That vagina, we start to kind of embrace the different aspects of what happens with the vagina, what happens with a woman and wholeness. So we've started a surgical series that we're going to continue today. We've talked about anesthesia and what's it like to be a pre-op patient. We've also discussed sling procedures and incontinence related issues. And we're going to touch upon prolapse today.
We also talked about uterectomy, and you've also got to hear from one of our patients who underwent a sling procedure, sling surgery, and sort of her experience with that and thereafter. So I
think the segue to this is we're going to try to get another podcast done talking about prolapse and what it's like from a patient perspective and having surgery done for pretty severe prolapse. So let's start today and kind of describing what is prolapse. And frankly, I bet you most of our listeners, unless you're in medicine, probably don't know what prolapse means. And you probably think of it in a different term. So let's touch upon that.
What is prolapse?
Well, medically speaking, the true definition is loss of support of one of the organ systems that exist in the vagina. And there's three of them. So cervix and uterus, bladder, and then the rectum. So one of those organs is actually falling down into the vagina. So if you think about it, in the vagina, there's like a shelf of support that keeps the bladder in a different location than the vagina. And through time, and we'll talk about this too, that shelf kind of weakens, loosens, and it pulls to the side. So essentially it's creating like a hernia where the bladder just prolapses down or the rectum prolapses up, cervix and uterus come down. Sometimes all three come together.
That's right. And just even to be a little bit more descriptive without sort of illustrations for people who are only listening at home, we often classically have described prolapse like a boat being sort of anchored in a harbor and suspended. So if you think of the lines and the water, the lines as being your ligamentous structures, connective tissue supports, and the actual water that it sits in being more of your traditional pelvic floor musculature, right? Or levator ani, or we could break that down into component parts or constituents. But essentially, that's sort of the support of the vagina. I know we loosely use that term in the media and socially with the pelvic floor, but really what we're referring to is that vaginal support and all of the bony structures around it, the connective tissue supports that go along with it, the blood supply, the nerves that go with it.
Absolutely. And I think when we see patients in the office, they commonly say, Dr. Kimble, my bladder's fallen down, or my cervix and uterus have fallen down. But that's all under the umbrella of prolapse. That's our expertise.
That's right.
But what causes prolapse? I mean, can anybody get prolapse?
That's a great question, because that's what most people ask. Like, what did I do to deserve this? What did I do wrong? How did this happen? What would you say some common reasons of prolapse are?
Well, first and foremost, I always say it's not your fault. You didn't do anything wrong. No activity, function, job is going to cause you to develop prolapse. But what I commonly tell patients is that it's not all about childbearing, right? We've both seen women who've had 10, 13 vaginal deliveries. no prolapse at all. We've taken care of nuns, huge prolapse, but they've never had any children.
Mhm.
So maybe childbearing is a component of it, but it's not the entire equation.
Right. Totally.
So things like genetics play a huge role in prolapse. You can kind of see it run through the family. Oh, my grandmother, my mother, my aunt, somebody, in the family had prolapse before. And that just puts them at a predisposition to develop prolapse.
Right. Aging is a
Yeah,
huge factor contributing to prolapse, just like any other part of our body, susceptible to the stresses of age and aging, the aging process. This is one way that the vagina manifests aging is with prolapse and lack of support, loss of support, diminished support.
absolutely. Now, is prolapse just a quality of life issue? I mean, is it a real medical condition that needs to be treated? What would you say?
I think that prolapse is certainly under the umbrella of quality of life, and it certainly falls under that. It's been characterized as a quality of life condition. And because it's been characterized as quality of life condition, I think there's many sort of uh, groups of individuals that purport to treat prolapse, address it, help with it. You know, from witch old wives' tales and a lot of sort of support, like ancillary supportive sort of groups, different exercises that can help prevent your prolapse or improve it. But I really do think, and we know this working in this area that we do, we see prolapse in all its stages. And at its most severe stage, so we stage it in a very quantified way with different measurements that are taken when at your first assessment. And sometimes that's not done by everybody, oftentimes. But when we are able to stage it, we also recognize that at its most severe stage, it starts to cause functional issues with the organs that really, really are involved, such as your bladder, your small bowel, your rectum, your perineum, your anus. So you could end up having a lot of what we call pelvic floor dysfunction. But when we say that, we're talking about the dysfunction in those organ systems. Oftentimes, because of that, what have you seen? Some like more advanced stage can cause like renal issues, right? Acute renal disease, and lots of problems that are related to the chronic condition and untreated conditions related to prolapse.
Yeah, so I collectively call this collateral damage, right? Because it's not the bladder's fault. No, it's not the kidney's fault, not the rectum's fault. But because of that loss of support, it causes damage. And we've both seen patients that are in end-stage renal failure. I'm going to dialysis next week because I have such severe prolapse, I can't empty my bladder. And over time, it's going to damage the
Right.
kidneys.
And we're talking individuals who live with years of this because they're told that it's quality of life. Don't worry about it. It's okay.
Part of the aging
Part of the aging
process,
process.
which is not true at all.
Right. It doesn't have to be. And certainly when it causes that kind of difficulty with normal everyday physiological function, it certainly needs treatment.
Absolutely. So that's a good segue into treatments. Because I have patients all the time come in and they say, hey, Dr. Kimble, I was talking to my primary care physician, I was talking to my gynecologist, and they said, nothing works. I mean, just live with it. I mean, it's not worth treating it. You're 60, so don't worry about it. Or you're 80
old.
or you're 90.
Yeah, you're old. It's normal.
Yeah, absolutely. And I'm like flabbergasted. Like, what if they had heart disease? They'd say, oh, go see the cardiologist right now. Go see the cardiothoracic surgeon. So I think we need to work through this crazy myth out there that prolapse is only a quality of life issue. Yeah, in an early stage, absolutely. It involves sexual dysfunction, changes in the vagina, intimate concerns, absolutely. Uh, Later stages, advanced stages, it's a medical condition. It needs to be treated. So what kind of treatments are there for prolapse? Let's start with the stages. Let's say I have stage 1 prolapse. It's going to come down just a little bit.
What would you say? I think there are many treatments, and it's hard to just say there's this treatment fits this stage or these treatments are appropriate for this patient. But truly, it really multiple factors go into weighing in, how we're going to counsel a patient related to treatment options. From, it's okay to watch this, see how you do, versus to let's have surgery and everything in between, the whole gamut. It really depends. And that's why I think a very detailed, thorough consultation is really important with a urogynecologist.
Correct, correct. If I can, I'm going to diverge for just a moment here because this is something that's very heartfelt to me. Let's go back in time a little bit. Let's go back to when we had vaginal mesh on the market, right? We use vaginal mesh often, very often, for the right patient, the right indication, for the right type of prolapse, and it worked extraordinarily well. Very safe, worked well. The problem is that a lot of doctors were taught how to do this procedure. So they did it on everybody with prolapse. This is the only thing they knew how to do. So they're like, oh, anybody with prolapse, I can treat it because I can do this one procedure. But every prolapse isn't equal to every other prolapse. So I agree with you. You have to individualize the treatment. It's got to be customized to that patient, their age, their lifestyle, the severity of prolapse, damage to surrounding organs, their own personal goals, their sexual goals, whatever it might be. It has to be customized.
And I think this goes back into sort of the team that is chosen to help you address your prolapse conditions. I think it's really important to recognize one, you know, what is the condition? What exactly is bothering you or causing some of your complaints? I hear a lot of people propose different diagnoses related to, this is due to this. And when they actually have their consultation with us, we determine that actually there's a host of conditions that the patient's suffering from. So this goes back to prolapse commonly being poo-pooed as a non-severe condition, something that someone could live with. And a lot of people have a lot of theories on how to treat it. But I think it's really important to sort of have the proper assessment so that you can also have everything addressed in the timely fashion to the degree that it bothers you and to the degree that it's severe and affects your life and your function.
So, I think that's a really good point you touched upon. Having a thorough evaluation, really assessing the surrounding organs, see what damage has been done, whether it's physical or it's functional damage. Either way, we need to know it before surgery, right? Because that's part of our planning surgically to decide how are we going to improve the function? How are we going to normalize the collateral damage? So in the hands of somebody who doesn't do this for a living, it's not their sole focus and expertise, it's not going to be thorough as such. So unfortunately, as a result of that, your outcomes are not going to be the same as what we can offer in our center, right?
I totally agree with that.
Now, do you think surgery is the only way of potentially treating prolapse?
I wish I could say yes, because it would make it a lot more simple to say you have prolapse and let me address it surgically. Certainly, surgically is the most definitive way to fix it, address it. But I have found in my practice and in our practice that, surgery is well complemented with other therapies.
Mhm.
And that's something you have to consider with this condition. And it's chronic, it can be lifelong, and it does require a change in your lifestyle and sort of how you think of your vagina, your vulva. And I guess if you want to extend that out to the pelvic floor.
Absolutely. I'll kind of go back to that comment I made about seeing a cardiologist or a cardiothoracic surgeon. Let's say, God forbid, I have a heart attack. Not that I'm wishing upon myself, but if that happens, the treatment is not just going in and repairing the veins of the heart, right? It's a multimodality. Nutrition, lifestyle, reduction in stress, medications to improve the heart function. So we kind of view it in a very similar fashion. It's not just surgery and then, oh, one and done. Not at all. It's multimodal. So meaning that maybe we need to strengthen the pelvic floor, rehabilitate the pelvic floor. Maybe we need to introduce some non-invasive therapies to improve the longevity of the prolapse repair. So there's various different components of your treatment algorithm above and beyond just surgery.
Thanks. I think surgery is a wonderful treatment. It can be very effective, has great durability. I guess, again, with the patient factor and the surgeon factor being key in that relationship. But yes, absolutely. I think there are multiple treatments and it has to be looked at that way. And the timing of your treatments also play a key role. So, prolapse is complex and it's very challenging when we see it simplified to something as, oh, my bladder is dropping. Oh, I had a bladder lift. It's not that simple. I wish it were, because it would make solving it very simple, but this has been a condition that women have suffered from for centuries. It's been around for a very long time. And happy to say that the treatments we offer today have evolved from what they used to be, like flipping you upside down to prevent the effects of gravity. We've exchanged some pelvic floor supports, pomegranates, to really kind of more sterile sanitary devices to kind of provide that support onwards and etc. So it's exciting time to have this condition, because we have a lot of wonderful solutions, wonderful treatments, and even wonderful innovations that typically were not applied into the space. It's very exciting for us in that regard, and we're very excited about sort of seeing prolapse evolve and change, even in light of the change of mesh being taken off the market, which is a total disservice to so many women all around the world, millions. But I hope that when one door closes, I hope another one opens and we find even better solutions to this very, very troubling condition.
Yeah, we've trained residents, which are doctors in training for, gosh, decades. And a very common question is this the only way you treat prolapse? Do you only do robotic surgery for prolapse, or do you only do vaginal surgery for prolapse? And the standard answer is absolutely not.
Yes.
I'm not going to employ one modality for every prolapse.
Thankfully.
Yeah,
because
exactly.
I mean, there's one of my favorite treatments in the right patient is a very old procedure. We sort of simplify the terminology and say, hey, it's vaginal closure, but it's a procedure that's been around for centuries and it originated in France. But essentially, it takes the ability to have future coitus. Great durability and solutions for the right patient, but I definitely don't want to be doing the same surgery for every patient. I think I'd make a lot of people very upset, like husbands and partners and life partners and things.
It's true. It's true. Absolutely.
Yeah.
So thus the importance, if you had listened to our podcast on anesthesia and preparation for surgery, Dr. Philip Lau, who's the chief of anesthesiology at Huntington Hospital, I asked him the question. I said, hey, Dr. Lau, what is the most important decision to make before you have surgery done? What was his answer?
Pick the right surgeon.
Exactly. Choose the right surgeon. Everything else surrounding that will come into place, virtually verbatim from his words. And we have found that so true. And we worked from New York to the Midwest to now the West Coast. So we've been in many different areas and locations. We've seen lots of different surgeons out there. Some are fabulous, phenomenal, and others I would not see. I just send my wife to. So every surgeon is not created equal. So it's very important to find the right skilled surgeon.
And I think, trusting your surgeon or your surgical team is really important. Certainly, I see in today's world, we do really advocate for patients sort of participating in their care and taking an active role. And we want to be involved in that shared decision-making with you. And we want you to be involved in that shared decision-making with us and all your treatment plans. But what I find very challenging is that when you come to us, we're going to give you our expert opinion based on, the 16, 17 years I've had in training to do what I do. And it's hard for me to explain to a level that could be understood why I'm recommending that. I do my best, and I know you do your best, but sometimes that's why you come to us. So we have a host of different patients. And I know one of the things is patients will tell me they did their research on Google, WebMD, YouTube, and they'll come in and propose treatments, or they want to put together their surgical team, kind of tell us when to do things and the timing of things. And I could tell you that that puts the patient I would say it's a disadvantage to patients, because we've really thought about how to approach it, how to approach these conditions, and what is in the best interest of the patient.
Yeah.
So with that, it's not just choosing the right surgeon, but it's just our entire treatment plan has been thought out. And it's really because we factor in all the things that weigh into your condition and how we can deliver things in the most positive manner, with the sort of to stack the odds that you'll have the best outcome.
Absolutely. And that's entirely what it's all about. It's outcomes driven, right? If we said, oh, 50% of you are going to have prolapse again, well, that's not a great outcome. So we want to work really hard in making sure that our outcomes data is the best possible,
Right.
so that you can rely upon that and say, you know what, I know going here, I have the greatest chance of the correction of the prolapse, reformation of normal function of the collateral damage, and also to make sure that it's going to last.
Right. And we want to walk down that road with you from start to finish, and really even thereafter, so that we can address anything that comes along the way. And I think that's part of it, is that we're prepared to do that. And I think that's a real strength, is that we do everything in our sort of what we know to sort of put you in the best position to optimize you for any treatment you're going to have. But even in that best case scenario, things can happen. And when that happens, we want to be the ones that sort of help you solve that problem.
In essence, when you come through our front door, we're gonna be there walking with you through this journey. It's not just you're done with surgery and we never see you again. We're going to see you every year. I mean, to that end, we've had patients fly from New York, our previous patients, to come see us because they need X, Y, or Z done, or they call to have a consult with us. So even though we're physically separated from New York, we're still part of that, right? We're there to continue that journey with our patients.
It is a lifelong relationship, and that's what we hope when you sort of become part of our center as a patient.
Absolutely. Now, let me shift gears here a teeny bit. Let's say I'm a listener out here listening to this podcast. I'm like, oh my God, my mom just had prolapse surgery, and I'm her daughter. She has a low voice, obviously. But, what am I going to do about it? Am I going to get prolapse? Is there any way I can make sure I don't get prolapse? What can I do? What would you say?
I would say it first starts with an evaluation. It's really hard just to say, hey, what can I do randomly? I mean, sometimes we meet people at a dinner party and, people learn about what we do, or in a social setting, and they ask, what can I do? And it's like, it's really hard for me to answer that question without really getting more data points from the actual patient in person.
Exactly. So the bottom line is, do you have to have prolapse to come see us? The answer is no. You could have a family history of it. And you really want to do something proactive to say, what can I do to help try to prevent me from developing prolapse in the future? So don't wait until your bladder's on the outside. Don't wait until you're in renal failure. If you've had children, you're like, oh, is this really going to affect me? Has it made some changes already? If you start to notice some subtle changes, that's the time to come see us. Let us start that journey with you at that stage in your life.
Right. And like I said, you might not even know you have prolapse. It might be named something different by your doctor or even by yourself. A lot of times you might not know what your actual diagnosis is. And that's sort of why you come to us, so that we can clarify that and really define and give you that diagnosis.
Absolutely. It goes back to the old adage that an ounce of prevention is worth a pound of cure. And, even though I sound like my father, God rest his soul, but it's true.
True.
So prolapse, not a fun condition to have, can totally interrupt your lifestyle. It can restrict your activities. It can interrupt any intimacy. It can lead to some collateral damage like renal failure. I am super constipated. I can't empty my bowels. I have constant pressure bulging. Maybe something's bulging outside the vagina. So see a urogynecologist. Come see us. We're here for you. We have patients come from all over the world to see us.
So having said that, we hope that we can help you. Please connect with us. Visit our website at www.kimblecenterforpelvicwellness.com. You can also direct message our team, and the messages will get directly to us. If it's something that you sort of would have some questions about, feel free to submit questions on our podcast link on our website, or simply call. This is the old-fashioned way, call. But we're here for you. Our staff is here, and we welcome your questions. And we hope that we can help you on this journey if it's a journey you need to take.
Absolutely. And you can just go online at our website. You can make an appointment here in our Pasadena office or upcoming Beverly Hills location in September.
Coming soon. Very exciting. We're starting to book in September. So if you want to be one of our first patients at our center, we certainly would welcome that opportunity to help you.
Indeed. So everybody have a wonderful, wonderful day. We look forward to seeing you soon. The next podcast, we're going to have a patient talking about prolapse and what it's like to deal with it personally and have surgery. So tune in.
All right. Bye.
Bye, everybody.
Thank you so much for listening to Vagina Talk podcast. If you want to learn more, you can find us on our web, www.kimblecenterforpelvicwellness.com. See you next time.
Bye.